Today I will be discussing about the most common prevalence and the issues with the usage of metered dose inhaler and what is spacer. See, this is called as a metered dose inhaler. It is a pressurized device, canister, in which the drug is there, and it usually delivers the drug for a month or two based on the prescription of the consultant. And how should be taken? Adherence and the technique is the key point of success. So how it should be taken? Always the metered dose inhaler should be preferably taken with the spacer. Spacer is nothing but a plastic tube like device by which one end is attached to the metered dose inhaler and the other end is holded between the lips. So why it should be taken with the spacer? Because the drug delivery, once the inhaler is pressed through the mouth, it goes through the mouth and then it bypasses the vocal cord, that is the laryngeal box, and then it goes to the lungs. So always it is better to use it with the spacer. The technique is we should shake the inhaler before using it. Second thing, we should attach it the other end of the spacer. This end of the spacer will be holding with the patient's mouth, and once it is done, he will accentuate it by pressing it. Once he is pressed, drug is delivered. He should inhale it with his mouth and exhale with his nose. It should be done for a period of 1 minute, so that 5-6 breaths will be done and all the drugs is deposited to the lungs. So if a doctor advises for a second puff, then again it should be pressed and the same technique should be used. And always the inhaler should be taken before breakfast and before lunch or whatever before food, because the stomach will be full once you are taking the inhaler after taking food, so that the capacity won't be so good. So it should be taken before it. Second thing, after usage it is always advisable and must to gargle your mouth, because we don't want the action of the drug to be in the mouth. So this is the best way of using the metered dose inhaler with the spacer. Thank you.